why do I feel lazy? Why don't I feel like going to the gym today? Menstrual health is not something that you have to deal with. It's something that you can work with. We can use that knowledge to be able to harness our workouts to make them more empowering. When I talk to my patients, they say, wow, I never knew that. If it's starting to interfere with your life, there may be something else going on. I think because people don't talk about it enough with each other, they just assume that what they're going through is normal. You shouldn't feel like you're alone in any of this. There's so much that we can do, and normalizing the conversation is more important than normalizing the symptoms. Understanding your body, understanding your hormones, that can be really empowering.
This is Fernwood Unfiltered, the podcast for straight up expert-based facts about women's health and fitness. And today we have another amazing episode for you. We are talking about hormones and periods as we learn about how to live and train with your body's month-long cycle instead of fighting against it. We'll explore how hormones affect your energy and strength through each phase of your menstrual cycle and learn about practical tips to help you sync your life and workouts for better performance and well-being. Dr Pav Nanayakkara is an advanced, minimally invasive gynecological surgeon passionate about women's health. She founded the Birth Bundle Project, which provides medical supplies to hospitals in developing countries. Dr. Pav is also an award-winning educator and mentor who believes in empowering her patients to make informed decisions. Dr. Pav, thanks for joining us on Fernwood Unfiltered.
Thank you. You made me sound very nice.
I think that you are. We've only just met, dear listeners, to pull the curtain back, but I think that you are a really lovely human.
Oh, thank you.
What made you so interested to get into this field?
I hate periods.
Yeah.
They kind of have the ability to take over your life a little bit. And I feel like it's an issue. I grew up with brothers. So it was a very much a I'm alone in this world kind of issue. And then working through it and going through medical school, you realize there's so much information out there that most people don't know.
So it's possible to not hate your period?
It is possible.
We are going to get into the nitty-gritty of that in this episode. For the woman who's listening to this, Dr. Pav, what do you hope that she gets out of our chat?
I'm hoping that she knows that your menstrual cycle is not something you have to deal with. Understanding your body, understanding your hormones, that can be a power.
Okay, I need this. I need this chat. I feel like there's such a gap in my knowledge when it comes to the most basic things around your period and your cycle. What is your menstrual cycle?
There are 4 phases to your menstrual cycle. So the first phase is the menstrual phase, and that's when you have your period. So it usually lasts 3 to 7 days, and during that phase, your energy levels can be a little bit low. You're shedding the lining of the uterus. The second phase is what we call the follicular phase, and that's from when your period ends up until you ovulate or you release an egg.
And how long is that typically?
So in a 28-day cycle, that's usually around day 14 that you would ovulate.
Okay.
So it's between the end of menstruation to ovulation that you would have your follicular phase. And during your follicular phase, your estrogen levels start to rise, and that's when you start to get a little bit more energy. You might feel a bit more focused and more driven. Your ovulation phase is your third phase. So that's when your estrogen levels are peaking. And that's when you might have the most energy, feel the most social, be more active. After you release an egg, the last phase is the luteal phase. That's the phase that most people hate. It's when the PMS symptoms can start to kick in. Your progesterone levels start to rise during that phase. You can start to feel a little bit lower, more fatigued, more tired, up until your menstrual phase starts again, and that's the start of your next period.
With the luteal phase, I've seen so many memes on social media around us being like, oh my God, I thought I was ugly, but it was fun. I was just in my luteal phase of my period. Our hormones, they can kind of trick our brains a little bit, right?
Absolutely.
And that's why understanding it is so important. And you know that, oh, hang on a second, that this is, for want of a better word, normal. I'm okay.
Yeah, absolutely. And even, so there's truth in that as well. There've been studies where they've taken photos of people during their luteal phase compared to their follicular phase, and from a completely blinded person, they look better in their follicular phase than their luteal phase. So there must be hormonal changes that even change your physical appearance.
Oh my goodness. When do you know that something might not be quite right with your menstrual cycle? It must be different for each one of us, I'm sure. When can we differentiate something happening with our cycle that may be a sign that something's actually wrong?
Yeah. So I guess your question is what's normal?
Yes.
And what defines normal is different for everyone. It's more about kind of trying to figure out what's your normal. Generally speaking, people talk about pain and heaviness of bleeding as kind of being the two main factors. So in terms of pain, having a little bit of discomfort with your periods can be a very common and normal thing. If it's starting to interfere with your life, so let's say you are doubled over in pain or missing work or missing workouts or managing your life around your periods, then that becomes a little bit more concerning because there may be something else going on like endometriosis or fibroids or adenomyosis. The same goes for bleeding. So defining a heavy period is also quite a tricky thing because from a medical point of view, we say more than 80 mils, but who actually measures that?
Yeah, how do you know?
So it's more if you're, needing to change sanitary products more than every 1 to 2 hours, or if you're soaking through menstrual cups, or you're starting to feel fatigued, tired. If it's starting to affect your quality of life, that's when it becomes a little bit more significant.
You use some very big words there. Endometriosis. We hear about that a lot as it's becoming more and more well known, as it's becoming more and more diagnosed. We're getting more education around that. What does it mean? Like what is it basically?
What is it? So endometriosis is a very common condition. It affects about 1 in 7 women. And it's where cells that are similar to the lining of the uterus that would normally be shed every month with a period are growing outside of the uterus. And so that can be up near your bladder, near your bowel, near your ovaries. It can grow anywhere. But typically speaking, the symptoms start off with pain that occurs during your cycle. So pain with sex, painful periods, pain when you go to wee or empty your bowels. And then that pain can start to change and can happen between your periods as well.
Wow. And it can be so debilitating for so many people. How is that treated?
So the treatment, we kind of imagine it like a little bit of a triangle. So there's the conservative stuff, which is at the top of the triangle. That's all the lifestyle changes that can be made. Things like optimizing your diet, making sure you're exercising properly, sleeping, managing stress, keeping your life well balanced, because it's all about reducing inflammation in the body. The second part of the triangle is medical management. So that can range from things like simple anti-inflammatories and painkillers to hormones to help manage your cycles. And the last part is surgery. That's not for everyone, but usually it's a laparoscopy, which is keyhole surgery. We put a camera in through your belly button and have a look, and we can treat endometriosis at the same time.
What about PCOS? I'm going to try and remember what it is because I should know. Polycystic ovarian syndrome?
Very good.
Oh, did I get that?
You've been learning.
I have been learning. I have been learning. Thank you, Dr. Pav. What does that mean? What is that?
Yeah, so that is a syndrome where people will often have signs of multiple cysts on their ovaries. So usually it's more than 20 on each ovary.
Wow.
And that can be associated with some other changes. So typically things like irregular periods, signs of excess testosterone, so things like acne or hair in places that it shouldn't be or more than would be expected. And those changes can then have implications on other factors in people's lives.
What kind of things?
So the main things are, because of the irregularity in periods, people can be at risk of things like endometrial hyperplasia, which is a condition where the lining of the womb builds up a little bit too much, and that can be a precancerous condition, so it can lead to cancer of the endometrium later on in life. The other thing is related to ovulation and fertility. So people with polycystic ovarian syndrome, because their cycles can be irregular, may find it harder to predict when they're releasing an egg. So it can be harder to then fall pregnant. The third thing is the implications on their heart and their blood pressure and things like that. So there can be what we call cardiometabolic implications. So issues like weight gain, high cholesterol, high blood pressure, that can put them at risk of heart disease later on in life.
Wow.
And then the last area is mental health. So we know that people with polycystic ovarian syndrome can be higher risk of things like anxiety and depression. So when we manage polycystic ovarian syndrome, we often get a team of specialists involved to kind of address all of those. It starts with having a really good GP who can kind of help balance everything. and involves regular visits. So, at least once a year to kind of do a general health check. But things like seeing a gynecologist to manage your periods, getting a fertility specialist involved if ovulation is an issue, dietitian, physio, all sorts of things.
What if our GP's not like you, Dr. Pav? You're so easy to have a conversation with.
There are lots of really good GPs and women's health specialists out there, and often it's about finding the right fit for you, because we're all going to mesh with different specialists in different ways. So what I would say is, if you're not meshing with your GP or your gynecologist, then get a second opinion. It's always okay to find someone that is the right fit.
I'm very interested in that kind of management of hormones. And I think for me, a lot of my life, I've sort of managed it with the pill, the contraceptive pill. And at points in my life, I've even skipped my period. And doctors have told me that that's fine. Is that fine?
That is absolutely okay. So a lot of people, when they think about the pill, they think about contraception, and they think that that's the main use of it. But we often use it for menstrual management as well. So from a period management point of view, what we're trying to achieve is to reduce ovulation. So we reduce the ovaries from releasing an egg. And we also try and keep the lining of the uterus nice and thin. So there's kind of two parts to that. So we call it ovulation suppression and menstrual suppression. And both of those can be valuable, not only from a pain and bleeding reduction perspective, but also in using it as a contraceptive at the same time.
How does the pill change your cycle? How is it doing all of that?
So the main way it works is by stopping the ovulation in the first place. So it stops your body from releasing the egg, which then stops your womb from building up a lining to shed.
What do you think most women's literacy is when it comes to their own menstrual cycle? Would you say that we've got a good literacy, or would you say it's not that great?
I think it could definitely be better.
Okay.
So I think in schools, the basics are taught. So what is a period and why does it happen? But in terms of understanding what's normal, what's not normal, when you should seek help, how do you manage your period around your life? That is very poorly discussed. And I find it a lot when I talk to my patients and they say, wow, I never knew that, or no one ever spoke to me about that. So definitely room for improvement there.
What do you think the number one question, or has there been a number one question that patients have asked you that seem to come up so often when they're coming to you, talking to you about their cycles?
I think because people don't talk about it enough with each other, they just assume that what they're going through is normal. So they normalize their symptoms, which means that people are often dealing with period pain or heavy menstrual bleeding for years before they'll come forward. So I think kind of understanding what's normal and when to seek help is a really, really important thing.
What do you think the biggest myth is about periods?
That you have to put up with it. I've had, CEOs coming and telling me that they're flooding through in meetings and having to use their folders to navigate around men.
Yeah.
And I've had young girls telling me they've been in agony at school and had to, go through swing carnival, feeling like they can't talk about it. So
isn't that such a thing? I feel like growing up, we've all got that one story of just being conscious that we've leaked or something's gone wrong.
Yeah.
And it's like, oh my God, what am I sitting on? You and I are both sitting on white chairs right now. Nightmare.
Yeah.
That would be a nightmare.
Yeah.
Like, it's just so fascinating and a conversation that we just don't have till it's too late.
Yeah.
It should be an open one.
Absolutely.
And we are just getting to scratching the surface on this conversation. If you're enjoying what you're listening to, if you're learning, as I am right now, Dr. Pav is staying with us. So we'll be back after this with even more chat.
We know strength training is pivotal for women's health, but motivation can be hard. What if you could do short, guided sessions with a community of like-minded women? Meet Fit30 at Fernwood Fitness. Perfect for the busy woman, in just 30 minutes, you'll get strong, sweaty, and hit key strength exercises. Expert coaches keep you motivated, supported, and challenged. Are you ready to crush your strength training in half an hour? Try Fit30, the home of strength training for women. Visit fernwoodfitness.com.au to learn more. Life gets loud. Between work, family, and everything in between, women are often the last to put themselves first. And that's where Gene Hales for Women's Health comes in. We're Australia's leading voice in women's health, here to back you with expert, evidence-based information you can trust. Whether it's understanding your hormones, navigating menopause, managing the mental load, or simply knowing which health checks to book, we've got your back. At Gene Hales, we believe better information means better health. Explore our info, tools, and resources at genehales.org.au and start saying yes to you.
Do we need to be worried, Dr. Pav, about potentially being on something like the pill long term? Personally, I think I've been on it now for more than 16 years. Is that okay? Should we be looking at alternatives? Do you need to come off it at a certain point?
It's definitely okay to be on the pill in the long term. But what I would say is any kind of hormonal management, contraception, it's something that you should revisit with your GP or gynecologist quite regularly. So at least once every 2 years, kind of check in and make sure that there's no better option, because there's lots of things, again, like periods that can be normalized. So you might have issues like breakthrough bleeding, or you might start to develop symptoms like pain or heaviness that your pill necessarily is not managing the way it could be, or there may be better options on the market for you. And so there are so many different pills out there now. There are also other options, things like intrauterine devices or IUDs. And so depending on what your priorities are or what your issues are, having that chat regularly can be a really good idea.
Can you maybe do a little bit of myth busting for me, or maybe even myth confirming? Is having an IUD implanted, I don't even know the correct terminology, is that painful?
So it's not quite implanted.
Not implanted?
Yes. So it is a little T-shaped device that sits inside the womb. We've got a little applicator that we use to put it in. Mm-hmm. Putting it in can be done awake or asleep, and most commonly it is done awake. Mm-hmm. Usually there are some steps that we take beforehand. So we often recommend some simple pain relief like Panadol or an anti-inflammatory just before the procedure. And then the procedure itself is quite quick. It takes about 5 to 10 minutes. There is some discomfort associated with it, and that can vary for different people. So often we would start by saying to the patient that you are 100% in control of this. And if anything is too uncomfortable at any stage, you stop, because we don't want you to suffer through this. Most people would rate that discomfort about 5 out of 10 in terms of severity, but it's very short-lived and it wears off. If it's more than that, then sometimes there can actually be a problem with either the actual insertion itself or the shape of the womb or something like that. And so any more discomfort than that should be a warning sign that maybe it's not the right time, or we should look at a different way of putting it in.
If you've been on a form of long-term contraception, when you come off of that, what can you expect to see from your body and even your brain? Like how can you expect to feel?
Different types of hormonal management have different wearing off periods. So something like the implant that sits in your arm or the intrauterine device in the womb, those usually once you take them out, your periods would start to come back very soon afterwards. There are other things like the injections that can take a while to wear off again. So sometimes there's sort of an 18-month delay before your periods can come back after that.
When you say injections, what do you mean? So you can take an injection for contraception?
Yeah, absolutely. So you'd see your GP and you get the injection. Usually it's once every 3 months, and that injection will effectively stop or reduce your periods.
Really?
Yeah.
How many different versions of contraception do you think, effective contraception or hormonal management, are there on the market right now?
So many. So I guess most people know about the pill. That's something that you are in control of and you take every day. Then there are what we call our long-acting reversible contraceptives, or LARCs. So LARCs start with things like the injection, which lasts for 3 months. There is a rod that can sit in your arm that lasts for 3 years. And then there's the intrauterine device. And there's 2 types of intrauterine devices, broadly speaking. There's the copper one. Copper one doesn't have any hormone. It can worsen your periods, but it's good for people that are sensitive to hormones. And then there's a hormonal option. And then within the hormonal option, there are 2 types. So there's one that has less hormone and is a little bit smaller and is mainly on the market as a contraceptive. And then there is one that's a little bit larger and has more hormone in it and works better for period management.
Oh, wow. My goodness. When you're the injections.
Yep.
What are you injecting? Like how does it work?
That is something that your doctor would inject.
Oh yes, it's not
you.
personal.
No,
You're not doing it yourselves, guys.
No.
Yep.
And so it's injecting progesterone, which is a hormone.
I've heard stories, and I'm not sure if this is the case, where girlfriends of mine say that they've come off the pill or some form of contraception, and they've felt like they've fallen off a cliff in terms of their mental health. They start to feel like quite depressed. They start to feel quite down. Is that hormonal? Is that a normal thing, or is that just a case by case?
Yeah, it can be very, very common because the pill is kind of stopping that luteal phase from happening. And when you come off the pill and you start cycling again, then you can go through that luteal phase where you are feeling that low mood, low energy, all of that. It's very, very common.
What happens after you've had a baby? So postpartum, when can you expect your periods to come back, and do they come back the same?
That's also a little bit different in everyone, and it can kind of depend on whether you're breastfeeding or not and how frequently you are. But if you are not breastfeeding, your period can come back as early as 6 weeks after your baby. And if you breastfeed, sometimes it's a few years.
Wow. Oh my gosh. But eventually, if nothing is amiss, your cycle can then return just as it was.
Yeah.
My God.
Body's amazing.
The body is amazing.
Why do you think I breastfed my kids for 3 years?
Breastfeeding prolongs you not getting your period. Why?
Because you're not ovulating. So when we call it lactational amenorrhea, which is a long medical word for breastfeeding, therefore not getting a period.
Oh.
And because your cycle doesn't kick back in again when your body is kind of conserving your energy towards feeding this child.
Can you get pregnant while you're breastfeeding?
If you ovulate, you can. And a lot of people don't know if they're ovulating or not, particularly if they're not having a period. So it's possible.
Potentially. If you are on the pill, how does that affect certain aspects of your cycle? Is when you're bleeding on the pill, is that the same as if I wasn't on the pill?
It's not quite a real period when you are on the pill and if you take your sugar pills. So when you take your sugar pills, you have what we call a withdrawal bleed, which is because you've been taking the hormones consistently and you stop taking them, you start to bleed. And then when you start your pills again, they would be the active pills that you take. That's when you start your cycle.
Mm-hmm.
But it's not a real cycle in that you're not really ovulating anymore. You're not releasing an egg.
How long after you stop taking the pill would you expect to see a quote unquote normal ovulation cycle return?
So if you were to stop taking it altogether, it would happen depending on what your cycles were like previously to taking the pill. That should start again shortly afterwards. So
really?
Yeah. But with most of them, and including the pill, as soon as you stop them or remove them, your cycle goes back to the way it was before.
Okay. And that's the time when you take note and you're like, okay, is everything okay? Is everything tracking right?
That's right.
Okay. So it is really important to track your cycle. That's what I'm gauging.
That is hugely important.
Okay.
Yes, because I think the big message here is understanding your body and understanding your hormones can really open the window to understanding so many other things about your mood, the way you feel, your energy levels, even with workouts, how to best kind of match your workout to your cycle.
Oh my God, I'm so excited about this. I've got so many questions. Number one, though, when it comes to tracking your cycle, what's the best way to do it?
So everyone does it a little bit differently. For some people, it's journaling, so writing it out. Other people find on their phone, there's some really good apps nowadays that can help you track your cycles. People use things like your basal body temperature and little ovulation kits that you can get from the chemist. So there's lots of ways. Whatever way will keep you doing it consistently is probably the best way.
Whatever way you can keep the habit.
Yeah.
Okay.
Yeah.
How does then our cycle affect our schedule in terms of a workout? Or how could it affect that? Is there a time that we should be doing more higher intensity workouts, a time when we should know to maybe pull back because we're not our best? Is it the luteal phase? I am speculating.
You learn quickly. So often people find that during their follicular or their ovulation phase, so just after you finish the period, your estrogen levels are rising, your energy levels are high, you're motivated. And so that's a really great time to be doing your high intensity workouts, your strength training. really getting into that zone 5 exercise. After that, so when your progesterone levels start to rise and your estrogen levels are falling, so the luteal phase and the menstrual phase, your energy levels are lower. So that's a good time to focus on a little bit more of the lower intensity stuff. It might be things like yoga or walking or Pilates. Focus on recovery during that time, mobility, stability.
Wow. So this is something that you can incorporate if you were going to the gym, if you're training and you're talking to your trainer. Is this stuff that they would be aware of, do you think? Would they know this?
I think a lot of the good women's health fitness gyms have an awareness of it. And certainly it's something that's being incorporated into physical training and sports now. But I don't think a lot of people know that they can talk to those people about it. And we can use that knowledge to be able to harness our workouts to make them more empowering.
Yeah. How can, for any practitioners who may be listening to our chat, how can they go about being empowering to their clients? What do you wish that they knew?
I think incorporating cycle tracking into a workout would be really valuable because then you're kind of helping to target the right type of training to where a patient is or client is in their cycle. So that can be a really, really valuable tool.
Yeah. Is it different for men?
Definitely. Men operate on a daily cycle. So when you plan a workout, often, their PT session will be around the same time every day. Testosterone levels tend to be a little bit higher in the mornings. And so for them, every day or every session can be fairly similar. Push, pull, legs, whatever it is. In a female patient or female client, obviously you need to try and factor in some of those hormonal changes because then you can really optimize your workout and minimize things like burnout and injury.
How can lifestyle kind of factors affect this too? Like how does your lifestyle affect your cycle, affect these hormones? Does it?
Definitely does. So hormones are kind of like people associate them with reproduction, but they are messages. They're the way our body signals to us what's going on. So they influence what we're feeling, how we function, how we live. And so in anything that can affect our lifestyle positively to reduce inflammation, to reduce stress, can have a positive impact on our hormones. And the flip side is if our hormones are out of whack, then we can try and optimize our lifestyle to help manage that as well.
How can we do that?
So it starts from all the simple stuff, what we eat, what we put into our bodies, eating well, minimizing sugar, fatty, processed foods, lots of fresh fruit and veg and omega-3s and fiber, all the good stuff. It's exercise, so having some form of reliable exercise to increase endorphins in our body. And the recommended amount is 30 to 40 minutes, 3 to 4 times a week at minimum. But I would always encourage everyone to do at least 30 minutes every day of something. Movement is medicine.
What about stress? I'm asking this as of personal interest to myself, as someone who's gone through different areas of stress, different levels of adrenaline over their career, a lot of shift work. How can that affect someone's cycle?
So stress releases a hormone called cortisol. And that can then have flow-on effects to other hormones in our body. So managing stress is a really, really important thing. I will often encourage my patients to do something every day. It can be something really little like 5 minutes of mindfulness, but it's also factoring in other things into your life to address the stress that starts to build up over time. It might be scheduling in a massage once a month or doing something, having me time. Hugely important.
It makes such a big difference.
Absolutely.
Wow. Why are periods not just a woman's problem? Why do we need men to have a base level understanding, or do we need them to have a base level understanding of what is going on with our bodies?
That would be ideal if they had some understanding at least, because they work with us.
Yeah.
Because, in my environment, there are a lot of male surgeons. There are male presenters, there are males everywhere.
Yeah.
And because our body functions differently to theirs, they may not necessarily understand why you need to leave a meeting all of a sudden.
Gotta go.
Or why you need time off, or why certain times of the month you're less productive. So having an understanding of that, both between women but also men as well, can be a really valuable thing.
Getting back to how we make our period work for ourselves, and I'm looking at this from a lens of potentially elite athletes. And we often hear stories of if you are an athlete when you're younger, potentially your cycle might be delayed, or maybe athletes actually do that intentionally because they think it affects their performance. Does your cycle affect your performance? How does it? And how can you harness that?
So predominantly it's related to those phases again. So we know that just after a period where your estrogen levels are high and continuing to rise, that's when you can really make the most of your workout or your exercise or your performance in sport. After you release an egg, we've got hormonal changes again, like the progesterone levels rising and the estrogen falling, that can influence your performance. So we can often use, management of cycles to help with performance, but also if there are conditions like severe period pain or heavy bleeding that are causing someone to feel really tired or affecting their ability to function, then using hormones to manage that can also influence performance.
What happens, do you think, if we stay completely unaware of our cycle? If we stay in the dark about it, we don't actively look at it, what can happen?
I suppose we are not necessarily maximizing what we can get from our workouts in those contexts because, there are I've had patients who, often in the lead up to their period, they feel really fatigued and they blame themselves. Why do I feel lazy? Why don't I feel like going to the gym today? And then it can actually throw off a routine. So someone who was previously going and having strength training every day, when they go through those periods of not wanting to do it, they just kind of drop the habit because they think maybe this is just too hard to maintain. But I think having an awareness of your cycles means that you would recognize, hang on, it's just that time of the month for me. I can get back to this and maybe just modify your workout a little bit to make it work for you.
This may be too personal of a question, but would you say that you have a good relationship with your cycle now? You don't hate it?
I don't hate it anymore.
Don't hate it anymore,
Yeah.
but you did.
There was a time when I hated it. That's why I'm where I am today.
Right. What was that time like?
That time was pretty awful for me. I had pretty terrible periods. And again, I had brothers and parents that just normalized it.
Yeah, that's your lot in life.
And the more I've kind of trained through medical school and gynecology, you realize that there's so much that we can do. And, normalizing the conversation is more important than normalizing the symptoms.
Your period doesn't have to be horrible.
It doesn't, no.
That's the bit. When your patients realize this, what's their reaction?
For me, the favorite part is when they come back, after they've tried something, made some modifications to their life or tracked their cycle. I often like to see them again 3 to 4 months down the line and they come back and they say it's a game changer. Understanding their body, understanding their hormones, just that in itself can be huge. But then if they've made some changes, for some people it's just lifestyle change. For other people it's adding in anti-inflammatories or hormones or having surgery. Everyone's different. But seeing them come back and say they feel empowered and they feel like it's been a life-changing thing, that's huge.
Given that there are so many different resources, so many different algorithms out there that are just putting up so much information, what are some trusted sources, in your opinion, that we can look to, our listeners can find if they're really interested in getting serious about their periods?
So I really like the Gene Hales website resources. They're amazing and they come in lots of different languages and they're also tailored for people with other special needs. So it's a very kind of widespread, globally accessible resource. But there are lots of other sort of resources that are produced by the government. So things like the Better Health Channel where you can learn more and then they have resources within themselves where you can go to.
For someone who's listening to our conversation and has learned a lot and is thinking, right, I am going to take control of my periods, I'm going to harness this, what are some practical steps for them to do immediately?
Yeah. The first thing I would say is track your cycle, know your body. So whether it's through an app or through a journal, find some way of understanding what's going on in your body and what's normal for you. The second thing I would say is if anything stands out as not normal, so anything's having a significant impact on your life, go and see your GP, women's health specialist, gynecologist, chat to someone about it. You shouldn't feel like you're alone in any of this. And then the third thing is with guidance and supervision and support, then you can start to make changes to your life to try and match or manage your life around your cycles and make it work for you.
What do you hope what's your number one most powerful takeaway for our listeners when it comes to cycle health and periods?
And it's just that menstrual health is not something that you have to deal with. So it's something that you can work with, understanding your body, understanding your hormones. That can be really empowering. And so I would hope that people walk away wanting to learn more about their bodies and understand what's going on within themselves and then use that to get the most out of their workouts going forward.
Well, Dr. Pav, you've made me more hopeful.
Thank you for having me.
Thank you so much for joining us on Fernwood Unfiltered. And if Dr. Pav has made you also think about exactly what is going on in your body, make sure that you share this episode with someone you love, because if it's helped you, it will help them. Until next episode, see you then.
Thank you for tuning in to Fernwood Unfiltered. If you learned something from this episode, help support the show by hitting follow and leaving a quick review. It's free, takes 30 seconds, and helps more women find us. Thanks again for being part of our Fernwood Unfiltered community. We'll catch you in the next episode.